Is there any detriment to the body with being on hormone treatment for long term? Like it doesn't assault the kidneys or the liver or the lungs as an ongoing treatment?
The bones. So with that class of the drugs, they will make the osteoporosis slowly worse.
So ribociclib, where does that fall?
Ribociclib is targeted therapy. There's no known cumulative toxicity from it, but it hasn't been around that long again to talk about 10 or 20 year toxicity, especially because it's used mainly in a metastatic disease now. In the recent couple of years, abemaciclib, which is a similar drug, is now getting used in early breast cancer. So that will certainly show us what the long-term side effects are in some 10-20 years. One thing that I could worry about with that class of drugs is the effects on the bone marrow, just because they can cause low counts. So similar to chemotherapies. With other hormone drugs, tamoxifen has cumulative long-term side effects of slightly increasing the risk of endometrial cancer. So yeah, they're not without long-term toxicities as well.
What about bisphosphonates? What about
Osteonecrosis of the jaw. So so the bisphosphonates have their problems in the long term, especially sort of 2-3 years and more into the treatment, and with the regimens that we use in metastatic bone disease, where we give it every month. So we know that the longer you are on treatment, the more of the risk of osteonecrosis of the jaw. So that's the side effect. It's quite rare, but the risk is slightly higher if there's any underlying dental infection. That's why if anyone's on bisphosphonates, or starting bisphosphonate, they need to see a dentist, make sure that they get dental clearance, and if they need any extractions on treatment, they need to stop the treatment to have the procedure done. The other complication, long-term complication with bisphosphonates and denosumab is also ironically bone fractures. So the thing that they're sort of meant to prevent, because they're slowing down the metabolism of the bone. Normally bone tissue is not static. There's always creation of new bone and reabsorption of the old, and it's sort of all the time, sort of like a road infrastructure. You always have to fix the little cracks in them. So what the bisphosphonates and denosumab do, they slow down metabolism, because the cancer utilizes that pathway to sort of reabsorb the bone. It sort of puts everything on hold.